Hello friends, welcome all of you on my YouTube channel here, Anand's Nursing File. Today in this video, we learn about the nursing care plan on cancer disease. This is very important care plan, and this care plan helps students for examination purpose, for theory and practical also. तो इस वीडियो में हम कैंसर डिजीज़ का नर्सिंग केयर प्लान लर्न करेंगे, जिसके अंदर हमने 10 नर्सिंग केयर प्लान कैंसर डिजीज़ पेशेंट के लिए तैयार किए हैं। और सारी केयर प्लान इम्पोर्टेंट है, और ये केयर प्लान मेडिकल सर्जिकल का एक इम्पोर्टेंट केयर प्लान है जो एग्जामिनेशन में पूछा जाता है। तो आप वीडियो को पूरा देखें। तो ये देखते हैं नर्सिंग केयर प्लान। ये नर्सिंग केयर प्लान में हम फर्स्ट देखते हैं जो हमारा डायग्नोसिस होगा, रिस्क फॉर इन्फेक्शन। यहाँ पर हम डिफरेंट नर्सिंग प्रोसेस स्टेप जो केयर प्लान्स में हम लिखते हैं, नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल एवेल्यूशन हमने यहाँ लास्ट में दिया हुआ है। मिस फर्स्ट केयर प्लान के लास्ट में जब हम सारे इंटरवेंशंस को कंप्लीट करेंगे, उसके बाद हम नर्सिंग केयर प्लान वहाँ पर आपको बताएंगे। तो फर्स्ट देखते हैं नर्सिंग असेसमेंट में सब्जेक्टिव डाटा। Here, subjective data not applicable because this is the risk diagnosis. Miss डायग्नोसिस रिस्क फैक्टर रिलेटेड है, तो यहाँ पर सब्जेक्टिव डाटा नहीं होगा। मिस पेशेंट का कोई भी यहाँ पर एक तरह से वर्बलाइजेशन नहीं है। नेक्स्ट ऑब्जेक्टिव डाटा है वाइटल साइन, मॉनिटर WBC काउंट, नर्सिंग डायग्नोसिस फर्स्ट रिस्क फॉर इन्फेक्शन रिलेटेड टू अल्टर्ड इम्यूनोलॉजिकल रेस्पॉन्स, गोल होगा टू प्रिवेंट इन्फेक्शन। नर्सिंग इंटरवेंशन रेशनल देखते हैं फर्स्ट, प्रमोट फॉर गुड हैंड वॉशिंग, स्टाफ एंड विजिटर्स, screen and limit visitors who may have infections, place in reverse isolation as indicated. Reason होगा protect patient from source of infections such as visitors and staff who may have an upper respiratory infection. Number second intervention emphasize personal hygiene. Rational होगा limits potential source of infection and secondary overgrowth. Number third intervention monitor temperature. Rational होगा temperature elevation may occur in infection. Number fourth intervention assess all system, skin, respiratory, genitourinary for sign and symptoms of infection. ये rational होगा early recognition and interventions may prevent progression to more serious situation or sepsis. Number fifth intervention होगा reposition frequently, keep linen dry and wrinkle free. Rational होगा prevent skin breakdown, potentiate site for bacterial growth. Number six interventions promote adequate rest and exercise period. Rational होगा prevent stasis complications, pneumonia, decubitus and thrombus formation. नंबर सेवन इंटरवेंशन होगा स्ट्रेस इंपॉर्टेंस ऑफ गुड ओरल हाइजीन। रेशनल होगा डेवलपमेंट ऑफ स्टोमेटाइटिस, इंक्रीज रिस्क ऑफ इन्फेक्शन एंड सेकेंडरी ओवर ग्रोथ। नंबर एट इंटरवेंशन अवॉइड ऑफ लिमिट इन्वेसिव प्रोसीजर, एडेड टू स्पेसिफिक टेक्निक। रेशनल होगा रिड्यूस रिस्क ऑफ कंटामिनेशन, लिमिट पोर्टल ऑफ एंट्री फॉर इन्फेक्शियस एजेंट। नंबर नाइन इंटरवेंशन monitor WBC with differential WBC and granulocyte count and platelets as indicated. ये रेशनल होगा monitoring status of myelosuppression, means here the bone marrow suppression and inability to bone marrow to produce blood cells is important for preventing further complications, infection, anemia or hemorrhage and scheduling drug delivery. Number 10 intervention obtain culture as indicated. ARS logo identifies causative organism and appropriate therapy. Number 11 interventions administer antibiotics as indicated. RIS logo may be used to treat identify infections or given prophylactically in immunocompromised patient. Evaluation होगा means after providing these interventions we write here the evaluation of first nursing care plan का evaluation है। इसमें हमको लिखना है ना पेशेंट आइडेंटिफाइज एंड पार्टिसिपेट इन इंटरवेंशंस टू प्रिवेंट रिड्यूस रिस्क ऑफ इन्फेक्शन। तो ये फर्स्ट केयर प्लान कंप्लीट हुआ। नेक्स्ट देखते हैं केयर प्लान नंबर सेकंड, रिस्क फॉर इम्पेयर्ड स्किन इंटीग्रिटी। इसके अंदर हम नर्सिंग असेसमेंट, डायग्नोसिस, गोल, नर्सिंग इंटरवेंशन, रेशनल देखते हैं. First, subjective data not applicable because this is the risk diagnosis, and objective data here monitor skin and IV site and vein for edema, tenderness. After these data, we write here the diagnosis on the basis of these assessment. A nursing diagnosis is risk for impaired skin integrity. Risk factor may include effects of radiation and chemotherapy. Goal होगा to maintain skin integrity. Nursing intervention रेशनल देखते हैं, नोट ब्रेकडाउन and delay bone dealing. रेशनल होगा reddening or tanning effect. Radiation reaction may develop within the field of radiation. Number second intervention, bath with lukewarm water and mild soap. रेशनल होगा maintain cleanliness without irritating the skin. Number third intervention, encourage patient to avoid vigorous rubbing and scratching and to pat skin dry instead of rubbing. रेशनल होगा helps prevent skin friction and trauma to sensitive tissue. Number four intervention, turn or reposition frequently. रेशनल होगा promote circulation and prevent undue pressure on the skin and tissue. Number fifth intervention, review skin care protocol for patient receiving radiation therapy. रेशनल होगा skin is very sensitive during and after treatment, and all irritation should be avoided to prevent dermal and injury. Number six intervention, avoid applying heat or attempting to wash off mark or tattoos placed on the skin to identify area of irradiation. Rational होगा help control dampness and pruritus. Number seven intervention देखते हैं, recommended wearing soft loose cotton clothing. Rational होगा to provide comfort. Number eight intervention, apply cornstarch, Eco4, lubriderm, Eucerin or other recommended water soluble moisturizing gel to area twice daily as needed. Aeration होगा reduce risk of tissue irritation and extravasation of agent into tissue. Number nine intervention, encourage liberal use of sunscreen or block and breathable protective clothing. Aeration होगा development of irritation indicate need for alteration of rate or dilution of the chemotherapy and change of IV site to prevent more serious reaction. Number 10 intervention, assess skin and IV site and veins for edema, tenderness, wild like patch, itching, burning or swelling, burning, soreness, blistering, progression of ulceration of tissue necrosis. या रेशनल होगा presence of phlebitis, vein flare, localized reaction or extravasation require immediate discontinuation of anti-neoplastic agents and medical interventions. Number 11 intervention, wash skin immediately with soap and water if anti-neoplastic agents spilled on unprotected skin, patient or caregiver. रेशनल होगा dilute drug to reduce risk of skin irritation and chemical burn. Number 12 intervention, advise patient receiving 5-fluorouracil, 5-FU and methotrexate to avoid sun exposure. Withhold methotrexate if sunburn present. Rachinoga sun can cause exacerbation of burn spotting, is a side effect of 5-fluorouracil, or can cause a red flash area with methotrexate which can exacerbate drugs effect. Evaluation होगा इसका. Means after providing these interventions, we write a evaluation of this care plan. Now your evaluation is skin integrity maintained. Next देखते हैं care plan number third, risk for impaired oral mucous membrane. यहाँ देखते हैं care plan को, nursing assessment में subjective data not applicable because this is the risk diagnosis, and objective data here assess oral cavity. Next, nursing diagnosis, risk for impaired oral mucous membrane. Risk factor may include side effect of some chemotherapeutic agents and antimetabolites and radiation. Goal होगा to maintain of intact oral mucous membrane. Nursing intervention रेशनल देखते हैं. First, assess dental health and oral hygiene periodically. रेशनल होगा provide baseline data of current oral hygiene for further comparison. Number second intervention, instruct to patient to assess oral cavity daily. Rational yoga to identify any abnormal change in. Number third, discuss and demonstrate methods of good oral care. Rational yoga may promote good oral hygiene. Number fourth, advise patient to brush with soft toothbrush or foam swab. Rational yoga prevent trauma to delicate and fragile tissue. Number fifth, interventions, instruct regarding dietary changes, avoid hot or spicy food, acidic juice, suggest use of straw, ingest soft or blend rice, food, popsicles and ice creams as tolerated. Rational yoga, severe stomatitis may interfere with nutritional and fluid intake. A dietary modification may make food easier to swallow and may feel soothing. Number six, intervention, encourage fluid intake as individual tolerated. Rational yoga, adequate hydration help keep mucous membrane moist, prevent dying and cracking. Number seven, intervention, use normal saline mouthwash. Here, rational yoga assist in removing debris in case of stomatitis. After these interventions, we write here the evaluation, और यहाँ evaluation होगा स्केयर प्लान का, maintained of oral mucous membrane, maintain of intact oral mucous membrane. नेक्स्ट देखते हैं केयर प्लान नंबर फोर्थ. फोर्थ केयर प्लान होगा अल्टर्ड न्यूट्रिशन लेस देन बॉडी रिक्वायरमेंट रिलेटेड टू नोजिया एंड वोमिटिंग. देखते हैं नर्सिंग असेसमेंट में सब्जेक्टिव डाटा, पेशेंट reports that inadequate food intake, altered taste sensation, loss of interest in food, perceived actual inability to ingest food. Objective data here, observed sign of malnutrition, monitor weight, assess intake and output. Here diagnosis होगा altered nutrition less than body requirement related to nausea and vomiting. गोल होगा to maintain nutritional status. नर्सिंग इंटरवेंशंस रेशनल देखते हैं. फर्स्ट, मॉनिटर डेली फूड इनटेक, हैव पेशेंट कीप फूड डायरी एज इंडिकेटेड. रेशनल होगा आइडेंटिफाइज न्यूट्रिशनल स्ट्रेंथ एंड डेफिशिएंसीज. नंबर सेकंड इंटरवेंशन, मेजर हाइट वेट डेली और एज इंडिकेटेड. रेशनल होगा इफ दीज मेजरमेंट फॉल बिलो मिनिमम स्टैंडर्ड, पेशेंट चीप सोर्स ऑफ stored energy fat tissue is depleted. Number third intervention, assess the skin and mucous membrane for pallor, delayed wound healing and large parotid gland. Rational yoga help in identification of protein calorie malnutrition, especially when weight and anthropometric measurement are less than normal. Number fourth intervention, encourage patient to eat high calorie nutrient rich diet with adequate fluid intake, encourage use of supplements and frequent of smaller meal is spaced throughout the day. Rational yoga, metabolic tissue need are increased as well as fluid to eliminate waste product. Supplements can play an important role in maintaining adequate caloric and protein intake. Number six intervention, adjust diet before and immediate after treatment. Clear cool liquid light or blend food, candied ginger, dry crackers, toast, carbonated drinks. Give liquid 1 hour before and 1 hour after meal. Rational yoga, the effectiveness of diet adjustment is very individualized. If relief of post-therapy nausea, patient may experiment to find best solution or combination, avoiding fluid during meal, minimize becoming full too quickly. Number seven intervention, administer antiemetics or a regular schedule before, during, and after administration of anti-neoplastic agents as appropriate. Rational yoga, nausea and vomiting are frequently the most disabling and psychologically stressful side effect of chemotherapy. Number 8 intervention, refer to dietitian or nutritional support team. Here rational yoga provide for a specific dietary plan to meet individual need and reduce problem associated with protein, calorie malnutrition, micronutrient deficiency. Number 9 intervention, insert and maintain NG or feeding tube for enteric feeding or central line for total parenteral nutrition TPN if indicated. Rational yoga, in the presence of severe malnutrition, a patient has been NPO per oral if, for 5 days and is unlikely to be able to eat for another week. Tube feeding or TPN may be necessary to meet nutritional need. After providing these interventions, we write here the evaluation step. एवेल्यूशन होगा मेंटेन न्यूट्रिशनल स्टेटस, ये तुम्हारा केयर प्लान नंबर 4। नेक्स्ट देखते हैं फिफ्थ केयर प्लान एयर acute पेन। सब्जेक्टिव डाटा देखते हैं केयर प्लान फिफ्थ का। पेशेंट वर्बलाइज अबाउट पेन। ऑब्जेक्टिव डाटा ग्रेमेसिंग, क्राइंग, मोर्निंग बिहेवियर, डिस्ट्रैक्शन, गार्डिंग बिहेवियर। डायग्नोसिस होगा acute पेन रिलेटेड टू डिजीज प्रोसेस, गोल होगा टू रिलीव पेन। नर्सिंग इंटरवेंशन रेशनल देखते हैं डिटरमाइन पेन हिस्ट्री, लोकेशन ऑफ पेन, फ्रीक्वेंसी, ड्यूरेशन एंड इंटेंसिटी यूजिंग न्यूमेरिक पेन स्केल 0 to 10। रेशनल होगा इन्फॉर्मेशन प्रोवाइड बेसलाइन डाटा टू एवेलुएट effectiveness of the interventions. Number second, interventions encourage the strategies of the pain relief that patient has used successfully in the previous pain experiences. Rational होगा encourage success of pain relief strategies accepted by the patient and family. Number third, intervention evaluate and be aware of the painful effect of particular therapies, surgery, dressing, chemotherapy, biotherapy. Provide information to patient and significant other about the what to expect. Regional होगा a wide range of discomfort are common incisional pain, burning skin, low back pain, headache depend on the procedure and agents when used. Pain is also associated with invasive procedure to diagnose or treat cancer. Number 4, intervention provide non-pharmacological comfort measures, massage, repositioning, back rub and diversional activities. Music, television, rational होगा promote relaxation and helps refocus attention. Number 5, intervention encourage use of stress management skills or complementary therapies, relaxation technique, visualization, guided imagery, biofeedback, laughter, music, aromatherapy and therapeutic touch. Rational होगा enable patient to participate actively in non-drug treatment of the pain and enhance sense of control. Number sixth intervention provide cutaneous stimulation, heat or cold massage. Here is logo may decrease inflammation, muscle spasm, reducing associated pain. Number 7, intervention evaluate pain relief and control at regular intervals. Adjust medication regimen as necessary. Rational होगा goal is maximum pain control with minimum interfere with activity of daily living. Number 8, intervention discuss use of additional alternatives or complementary therapies, acupuncture and acupressure. Number 8, rational होगा may provide reduction or relief of pain without drug related side effect. Number 9, intervention administer analgesics as indicated, opioid, codeine, morphine, acetaminophen, Tylenol, and non-steroid anti-inflammatory drug NSAID and including aspirin, brufen, corticosteroid. Rational होगा to relieve pain and inflammation. After providing these interventions, we write it the evaluation. Now evaluation is pain is relieved and patient feel comfort. Next care plan देखते हैं. Number 6 care plan here nurse assess nursing assessment, nursing diagnosis, goal intervention, rational. नर्सिंग असेसमेंट में नर्सिंग असेसमेंट में सब्जेक्टिव डाटा पेशेंट वर्बलाइज अनरेमिटिंग ओवरवेलमिंग लैक ऑफ एनर्जी एंड इनएबिलिटी टू मेंटेन यूजुअल एक्टिविटी. ऑब्जेक्टिव डाटा पेशेंट शोइंग लेथार्जी, लिस्टलेसनेस बिहेवियर एंड डिसइंटरेस्ट इन सराउंडिंग्स. नेक्स्ट नर्सिंग डायग्नोसिस देखते हैं फैटिग रिलेटेड टू डिक्रीज मेटाबॉलिक एनर्जी प्रोटेक्शन. गोलों का टू रिड्यूस फैटिग इंटरवेंशन. रेशनल देखते हैं फर्स्ट इंटरवेंशन assess fatigue by using a numeric scale if possible and the time of the day when it is the most severe. Rational होगा help in developing a plan for managing fatigue. Number second intervention place care to allow for the rest period, scheduling activity for periods when patient has most energy, involve patient and significant other in scheduling planning. Rational होगा frequent rest period and naps are needed to restore and conserve energy. But third intervention establish realistic activity goal with patient. A rational होगा provide for a sense of control and feeling of accomplishment. Number fourth intervention assessed with self-care need when indicated keep bed in low position, pathway clear of furniture, assist with ambulation. रेशनल होगा वीकनेस में मेक एक्टिविटी डेली लिविंग डिफिकल्ट टू कंप्लीट और प्लेस द पेशेंट रिस्क फॉर इंजरी ड्यूरिंग एक्टिविटी. Number fifth intervention होगा encourage patient to do whatever possible self bathing, sitting up in chair, walking, increase activity level as individual is able. Rational होगा enhance strength and stamina and enable patient to become more active without undue fatigue. Number six intervention होगा refer to the physical or occupational therapy. Here rational होगा program daily exercise and activity help patient maintain and increase strength and muscle tone and a sense of well-being. After providing these interventions, we write a evaluation. Evaluation is now fatigue and reduce and patient perform activity of daily living ADLS and participate in desired activity at level of ability. Next देखते हैं नंबर 7 केयर प्लान एंटिसिपेटरी ग्रेविंग ईयर. Nursing assessment, subjective data, patient denial to potential loss and verbalized expression of distress. Here, objective data here, changes eating habit, alteration in sleep pattern, activity level and communication pattern. Nursing diagnosis, grieving related to anticipated loss of physiological well-being goal होगा appropriate progression through grieving process. Intervention rational देखते हैं. First intervention increase verbalization of fear, concern and questions regarding disease. rational होगा accurate knowledge, decrease anxiety. But second intervention assess patient and significant other for the stage of grief currently being experienced. Explain process as appropriate. rational होगा knowledge about the grieving process reinforce the normality of feeling and reactions being experienced and can help patient deal more effectively with them. Next intervention use therapeutic communication skill of active listening, acknowledgement and so on. rational होगा promote and encourage realistic dialogue about the feeling and concern. Fourth intervention encourage verbalization of the thoughts or concern and accept expression of the sadness, anger, rejection, acknowledge normality of these feelings. Rational होगा पर patient may feel support in expression of the feelings by the understanding that deep and soft conflict emotions are normal and experienced by the in the difficult situation. Fifth intervention visit frequently and arrange for care provider and support person to stay with the patient as needed. Rational होगा help reduce feeling of isolation and abandonment. Next, number 6 intervention reinforce teaching regarding disease process and treatment and provide information as appropriate for dying. Be honest, do not give false hope while providing emotional support. यहाँ पर रेशनल होगा पेशेंट एंड सिग्निफिकेंट अदर बेनिफिट्स फ्रॉम फैक्चुअल इंफॉर्मेशन. इंडिविजुअल में ask direct question about the death and honest answer promote trust and provide reassurance that correct information will be given. Number 7 intervention identify positive aspect of the situation. Here rational होगा possibility of remission and slow progression of the disease and new therapies can offer hope for future. Number 8 intervention discuss with patient and significant other can plan together for the future. Encourage setting of realistic goal. rational होगा patient in problem solving and planning care provide a sense of control over anticipated events. Number 9 intervention involve spiritual advisor as desired by the patient and family. rational होगा provide support in meeting spiritual need of the patient. Evaluation होगा means after providing these interventions हम यहाँ नर्सिंग केयर प्लान का evaluation लिखेंगे. Evaluation होगा continue our normal life activities looking toward and planning for future. Next care plan देखते हैं. Number 8 situational low self esteem. Nursing assessment diagnosis goal intervention rational. Next nursing assessment में subjective data verbalization of the changes in lifestyle and objective data here lack of follow through change in the self perception. Nursing diagnosis here spiritual low self esteem may be situational low self esteem may be related to biophysical, psychological, and spiritual crisis. Goal होगा improve self-esteem, nursing intervention, and rational. First intervention discuss the patient and significant other, how the diagnosis and treatment are affected the patient's personal life, home, and work activities. Rational yoga adds in the defining concern to begin problem solving process. Number second intervention, identify potential threat to patient self-esteem. Rational yoga provide baseline data for intervention. But third intervention देखते हैं, encourage the discussion of the concern about effect of concern and treatment on role and homemaker ways earner partner and parent and so forth. Rational yoga may help reducing problem that interfere with acceptance of treatment or stimulate progression of the disease. Number fourth intervention, acknowledge difficulties patient may be experiencing, give information that counseling is often necessary and important in the adaptation process. Rational yoga validates the reality of the patient's feeling and giving permission to take whatever measure are necessary to cope with what is happening. Number fifth intervention, provide emotional support to the patient and significant other during diagnostic test treatment plan. Irrational yoga पर, although some patients adapt or adjust to cancer effect or side effect of therapy may need additional support during this period. Number six intervention, refer for professional counseling as indicated. Rational yoga may be necessary to regain and maintain a positive psychological structure if patient and significant other support system are deteriorating. After providing these interventions, we write here the evaluation. Now evaluation is now improved self-esteem. Next देखते हैं 9 केयर प्लान here. 9 नंबर केयर प्लान होगा हमारा रिस्क फॉर फ्लूइड वॉल्यूम डेफिसिट नर्सिंग असेसमेंट not applicable because this is the risk diagnosis. And objective data देखते हैं here, monitor intake and output and specific gravity, monitor vital signs, check weight, assess skin turgor and moisture of the mucous membrane. After writing these data, we write here the diagnosis. Now diagnosis here, risk for fluid volume deficit may be related to impaired intake of fluid, goal होगा impaired intake of fluid and vomiting and diarrhea. Goal होगा to maintain adequate fluid volume. Nursing intervention rational देखते हैं. First intervention, monitor intake and output and specific gravity, include all output source, MSS, diarrhea, draining bone, calculate 24 hours balance. Rational होगा continued negative fluid balance, decreasing renal output and concentration of urine suggests developing dehydration and need for increased fluid replacement. Number second intervention, weight as indicated. Rational होगा sensitive measurement of the fluctuation in fluid balance. Number third intervention, monitor vital sign, evaluate peripheral pulses, capillary refill. Rational होगा reflect adequacy of the circulating volume. Number fourth intervention, assess skin turgor and moisture of mucous membrane, note report of thrust. Rational होगा indirect indicators of the hydration status and degree of deficit. Number fifth intervention, encourage fluid intake to 3000 ml per day as individual appropriate or tolerated. Rational होगा assist in maintenance of the fluid requirement and reduce risk of harmful side effect such as hemorrhagic cystitis in patient receiving cyclophosphamide cytoxan. Number six intervention होगा observe for bleeding tendencies oozing from mucous membrane puncture site, presence of ecchymosis or patchy. Rational होगा early identification of problem which may occur as a result of cancer or therapies allow prompt intervention. Number seven intervention, minimize venipuncture, combine IV start with blood draw, encourage patient to consider central venous catheter placement. Rational होगा reduce potential of hemorrhage and infection associated with the repeated venous puncture. Number 8 intervention होगा avoid trauma and apply pressure to puncture side. Rational होगा reduce potential for bleeding and hematoma formation. Number 9 intervention, provide IV fluid as indicated. Rational होगा give for general hydration and to dilute antineoplastic drugs and reduce adverse side effect nausea and vomiting or nephrotoxicity. Number 3, interventions monitor laboratory studies CBC electrolyte serum albumin ration log provide information about the level of hydration corresponding deficit. After providing these interventions, we write here the evaluation और यहाँ evaluation होगा maintain adequate fluid volume. Next number 10 diagnosis होगा risk for constipation or diarrhea. Nursing assessment not applicable because this is the risk diagnosis. And objective data assess the elimination pattern, assess bowel sound and record bowel movement. Number 3, monitor intake and output and weight. After writing these data, we write here on the basis of this data, we write here the nursing diagnosis risk for constipation, diarrhea. Risk factor may include irritation of GI mucosa from either chemotherapy or radiation therapy, and metabolism, malabsorption of fat, goal होगा to maintain a usual bowel pattern. Nursing intervention देखते हैं first ascertain usual elimination habit. Rational होगा data required as baseline for further evaluation of the therapeutic need and effectiveness. Number 2, intervention assess bowel sound and record bowel movement, including frequency, consistency, particularly during first 3 to 5 days of the bin calculated therapy. Rational होगा benefits problem diarrhea, constipation. Note constipation is one of the earliest manifestation of the nephrotoxicity. Number 3, intervention monitor intake and output and weight. Rational होगा dehydration, weight loss and electrolyte imbalance and are complication of diarrhea. Inadequate fluid intake may potentiate constipation. Number 4, intervention होगा encourage adequate fluid intake 2000 ml per 24 hour, increase fiber in diet, regular exercise. Rational होगा may reduce potential for the constipation by improving stool consistency and stimulating peristalsis and prevent dehydration associated with diarrhea. Number 5, intervention provide a small frequent meal or a food low in residue if not contraindicated, maintaining need protein and carbohydrates, egg, cooked cereal, blend cooked vegetable. Rational होगा reduce gastric irritation. Use of low fiber food can decrease irritability and provide bowel rest when diarrhea prevent. Number 6, intervention adjust diet as appropriate. Avoid food high in fat, butter, fried food, nut foods with high fiber content, those known to cause diarrhea or gas. Gavas, wag, bean, chills, food and fluid high in caffeine or extremely hot or cold food and fluid. Rational होगा GI stimulants that may increase gastric motility, frequency of stool. Number 7, intervention check for impaction if the patient has not had a bowel movement in 3 days or if abdominal distension. Rational होगा further interventions and alternatives bowel care may be needed. After providing these interventions, we write here the evaluation of this care plan. Here evaluation is maintain usual bowel pattern. फ्रेंड्स ये था आज का हमारा वीडियो नर्सिंग केयर प्लान ऑन कैंसर डिसऑर्डर. दिस इज़ वेरी इंपॉर्टेंट केयर प्लान फॉर from medical surgical nursing subject, and this video helps students you in the examination purpose in theory और practical exam. फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस वीडियो विद योर फ्रेंड्स एंड सब्सक्राइब माय यूट्यूब चैनल on the nursing file, a preparation for the nursing competition examination, and press bell icon also. Thank you.